Hi, my name is Ankita Gupta. I'm a urogynecologist with U of L Health. So for me, I think it was a combination of knowing I wanted to do something to help people. Like I always wanted to be in like a field or a specialty where I could make a difference in people's lives. And so medicine kind of seemed like a natural fit for me. I always liked school. I always liked to study. I always kind of like wanted to find like a way to merge those. And then when I was in high school, my grandfather fell ill and I spent a lot of time in the hospital with him and kind of just seeing how healthcare worked, and that really clicked for me. I'm a urogynecologist, so I'm a female pelvic medicine and reconstructive surgeon. So that's a fancy way of saying I listen to women when they have problems that they don't feel comfortable talking about. I take care of women with prolapse, I take care of women with incontinence, I take care of women with pain. And often it's like different kinds of pain, pain with intercourse, pain with voiding. I take care of people when they don't want to share like embarrassing details about themselves. A big part of what I do is listen and figure out how best I can help them. I kind of try to come at it from like, what are the patient's biggest goals? Like, what do they hope to achieve? And trying to kind of find a best way to make that happen. I always tell my patients, it's not me telling them what to do. We come up with a plan together. So we come up with kind of like, what goals do they want or what is most important to their quality of life. And really like my goal is to make that quality of life better. And whether that's with doing medications, whether that's with doing surgery, or whether that's with even doing simple lifestyle changes that they may not realize could make a big difference in their lives. I trained in OBGYN and then I spent 3 more years becoming a urogynecologist. And one of the things that's really neat about our specialty is we can take care of women from a urology, colorectal, and like gynecology perspective. So we have this like 360-degree view of the pelvic floor, and so kind of helping women with many different pelvic floor issues. And then one of the neat things also about the fact that I've been in Louisville for so long, I trained here, I did my fellowship here, is I'm pretty like connected with the community, and we learn how to do surgery in different modalities. So we can do vaginal surgery, laparoscopic surgery, robotic surgery, kind of just based on what the patient needs and what their goals are. My husband and I made this goal a few years ago to visit all 50 states. So we're trying to kind of hit all of them. So it has to be that you have to stay overnight in the state for it to count. So it doesn't count if you just like fly over it. So I'm at 34 states. So that's my goal, is to kind of hit all 50.